Hello, my name is James Hoffman, and I first want to start by expressing some gratitude for allowing me to express interest in future employment at Colorado Christian University and for getting this far in the interview process. Today's lecture, I'm going to be spending a few moments discussing ethics and specifically ethical decision making. Because of the short amount of time in today's lecture, I'll just be providing a brief overview, and I would like to end with just a few moments of consideration of ethics from a Christian perspective. So I'm going to be sharing the screen at the moment to pull up my PowerPoint. So, ethical decision making. I want to start with just expressing a few thoughts to what ethics are in overall. Ethics are the principles that govern our behavior, our conduct. This is not anything particularly unique to the counseling field. Uh, Ethics are described in all walks and spheres of life, various professions, but as counselors and as clinicians, you guys will all have to be held to a certain standard for what you do in every aspect of your practice. Ethical decision making then speaks to the actions that one takes as a what we call an ethical dilemma may arise. So as you uh, begin your practice, as you sharpen your skills and build confidence, some actions in counseling may take less thinking. That doesn't mean thoughtless. What that means is that you'll have the experience and the knowledge of what the clear path forward is. However, there's going to be some issues that may arise that are going to require much more than simply a quick decision. And that's what we'll be discussing about today. So, briefly, ethical principles in general. The American Counseling Association has provided a list of various principles. I have them here listed for you of what ethics covers in our field. The first is autonomy. So this speaks to allowing the freedom and choice of action in our clients. So as therapists, we help in the various fields that we have expertise in, but recognizing that there is a sort of limitation in that we cannot make anyone do anything. So we have to respect that, nor would we want to force that upon them. It may actually cause more harm than good. Justice speaks to treating a person based upon the appropriate necessities. I want to be clear, there's a saying, um, uh, equality for all. And it's important to realize that when we're speaking about justice, simply providing equality for all might not be enough. For instance, it would be unjust to provide equal services for someone who has a deficit, maybe a disability. Let's say you have a counseling practice and there's a flight of stairs to get to your office, but one of your clients is in a wheelchair. Well, is that just for them to be able to get up those steps? It would not be. They would need adaptive equipment or a ramp, something like that. Providing that sort of service where others might not get that is justice. And so that's what we're speaking about in ethics. The next two, beneficence and non-maleficence, this is speaking to two steps that are very closely related, yet importantly different. First, beneficence is speaking about the intention of doing good to a client. When I talk about this ethical principle in the classes that I've taught in times past, I always like to highlight the need for being skilled and knowing one's abilities in helping their clients. For instance, when a graduate goes and becomes licensed in a state and starts practicing, it's important for them to gain and to continue to develop and sharpen their skills and knowledge well past graduate school. For some who graduate at better programs, such as this one here, there's a sort of, I have a confidence now because I was in a good program. I learned a lot of knowledge. But even the best graduates, even the best clinicians, need to continue to develop and learn. And that's what this speaks to. Non-maleficence, on the other hand, is neglecting to pursue a course of action for the client's good. So knowing exactly, let's say, a treatment to offer, but deciding this might not be the best time for them. And so finally, we have fidelity. And in this ethical principle, we highlight the faith in the therapeutic relationship. So what this speaks to is allowing the client to gain trust in their therapist. I sometimes refer to this as the magic of therapy, right? It's what makes therapy more than simply a handout of resources. Why are we a little bit better than simply Googling or searching and finding cognitive behavioral therapy exercises? Well, because we can build trust with the client. And that's something that has to be done intentionally by the therapist. Moving on, we have the ACA decision-making model. I have it listed here for you. I just briefly want to hit on a few of these for sake of time. And if I'm able to give more lectures down the road, I would love to go into further of these. But here are your 7 steps. 1, identify the problem. When an ethical dilemma arises, it's important to always have this in mind. Sometimes in school, in graduate programs, we talk a lot about research and having a research problem, and you need to know that throughout so you don't lose track of what you're trying to, what path you're trying to follow. It's the same that goes for this. Don't forget what problem that you are trying to solve and making a decision. Number 2 is the most probably important of these steps. They're all important, but applying the ACA Code of Ethics, it's important to know what these codes of ethics are, not just when the ethical dilemma arises. You must be familiar with them so that they are something that you can refer to with more efficacy rather than waiting until this comes and goes, I've never looked at this before. Step 3 is to determine the nature and the dimensions of the dilemma. So a therapist might have a dilemma and they're considering it. This is the step where you bring in consultations, ask supervisors, ask other therapists. Of course, respecting privacy, but getting help where considerations on one's own might fall short. Step 4 is to generate a potential course of action. Once you start to see a way of, hey, this seems like a good path to solving this in the best way possible, you want to kind of pause for a moment. Don't jump right into action. Consider what could happen. And that brings us right into number 5, the potential consequences. So what are all the possible paths? That's number 4. And 5, down each path, what does it lead to? This will not just, it won't necessarily guarantee exactly what you planned for, but it will definitely help in potential surprises that might be along the way of any decision made. Step 6 is to evaluate the selected course of action. Go over it again. I cannot stress that enough. Check, check, check. And finally, nothing left to do but implement. When you've received and done all of the work, putting it into action with that faith that you have the best of the clients in mind, and go forward. I wanted to end our talk today with a quick consideration about ethics as a Christian clinician. This is what separates us from other programs where a lot of the same skills and certainly ethics are considered. But as a Christian, we are held to a higher standard, the biblical standard. And so sometimes a simple code of ethics is not enough for the Christian, not enough for the Christian person or the Christian clinician. And so I provided here a resource that's been helpful to me throughout the years. This came to me in my graduate program quite some time ago, and it stuck with me throughout. And so in the PowerPoint here, you see um, the various authors have considered not just ethical principles, but where should a Christian stand? So as you see down here, some of these things like compassion, servanthood. Um, One that I like the most is love over this sort of Rogerian unconditional positive regard. Well, as a Christian, we have a love for others, right? We're to love um, our neighbor as ourselves. We're even told to love our enemies. And so this goes much deeper than simply a positive regard. And as a Christian therapist, these are the guidelines that we should be striving to live in our daily life. And that way it will elevate us so much more in our practice. So, with that being said, I provided the reference if anybody would like to look over it, and I'm certainly open to discussing these concepts with you all. But I just want to again thank you all for this opportunity, and